Welcome back to What the Heck? Health Education and Conversations, a podcast by the Oregon Primary Care Association. Here we explore the health policies, partnerships, and care teams shaping community health across Oregon. From healthcare delivery to workforce challenges, this podcast brings you conversations that inform, inspire, and spark the transformation of care to sustain a reliable, high-quality network for those in the most need. Each episode features conversations with primary care leaders and partners working to strengthen Oregon's healthcare safety net. If you've been following along with our recent episodes, you've heard us sit down with Oregon State Representatives Ed Diehl and Cyrus Javadi to talk about healthcare delivery in our state. If you are joining us for the first time, please take a moment to listen to those conversations. Today, we're taking a step back to reflect on what we heard, highlight the moments that made us think twice, and the insights that are too significant to let pass by without a closer look. The theme tying it all together? Advocacy. Specifically, what it looks like to build a culture of advocacy within our organizations, our teams, and the health center movement as a whole to ensure our message that federally qualified health centers are efficiently and effectively delivering comprehensive care to our communities. The question for today is, why should I develop a culture of advocacy? Before we dive in, I'd like to thank the physician office dispensing experts at RX Fusion for making these conversations possible. If you're looking to improve patient outcomes, speed time to therapy, and improve revenue, RX Fusion allows you to dispense medications directly in your practice, boosting satisfaction for both staff and patients while saving money compared to contract pharmacy. Before my colleagues joining me today introduce themselves, I'd like to share a little more about myself. Not only am I your host, I am also the communications manager at the Oregon Primary Care Association. I have the privilege of working closely with Oregon's federally qualified health centers to amplify how they deliver community-focused, patient-centered healthcare. I also help health centers advocate on behalf of their patients and themselves so that they can continue delivering that much-needed care.
My name is Erin Woods, and I am the health policy analyst here at the Oregon Primary Care Association. One of the things that I do actively work on is trying to figure out how we can better meet the advocacy needs of our health centers here in Oregon. And so I am the co lead of our advocacy work group with Dani. Before working at the Oregon Primary Care Association, I worked in the building in a organization called the Legislative Policy and Research Office, which is a nonpartisan office that supports lawmakers and supports the committees that they run. And so I was in charge of supporting the Senate Healthcare Committee and supporting the day-to-day functions of that committee to ensure that it ran smoothly, which the main thing that I think that gave me is just an insight into how the legislative process works and also how much is on lawmakers' plates, the political environment in the building and how many different advocates there are and how each one of them is coming to lawmakers and going, this is the most important thing that has ever existed. So they're getting told that day in and day out. And then before that, I interned with Senator Merkley's office. And so I got a little bit of a insight into how issues were handled at the federal level as well. There is some definite stark differences, but also similarities. The main thing that that background gave me is just a really big insight into how many different issues are on the docket at one time. And so, how do you try to, as an advocate, make your way through all of those other competing priorities that lawmakers are hearing about?
Hi, I'm Marty Carty. I'm the Director of Government Affairs at the Oregon Primary Care Association. Something that I like to share with folks that most don't know about me is I was a paramedic for 10 years. And I didn't know it at the time. I had a front row seat to how the American healthcare complex fails the most vulnerable people in our communities. And I decided to transition out of that work because I wanted to have a bigger impact on the lives of my fellow community members than one band-aid at a time. And now I work in government relations. I worked with the legislature for a session with the city of Portland, Office of Government Relations. I worked for Congressman Earl Blumenauer here in the state in his political office. And I had an opportunity to run a political campaign for a state candidate and then worked for him in the legislature for 2 sessions. At the time, State Representative Mark Meek, now Senator Mark Meek. Erin did a really nice job. I say this all the time. If we as House senators or advocates aren't talking to lawmakers, someone else is. And I did the scheduling for Representative Meek. And I can tell you, you're scheduling 20-minute meeting blocks back to back to back. And every one of those is filled with somebody who has something they want a member's attention on. But that's why this work is really enjoyable. I get to learn a lot and then dive into the things that really matter to House senators.
I'm really excited to hear your thoughts on the interview that we had with both Representative Ed Diehl, the Vice Chair of the Oregon House Committee on Healthcare, and the conversation I had with Representative Cyrus Javadi.
Before we get into the conversation that you had with Representative Diehl, I think we just need to acknowledge that when we recorded that episode, it predated the legislative session. It also predated his announcement that he's running for governor. So the context of the conversation you had with him really was focused on his role as vice chair of the House Committee on Healthcare. And now his comments are even more salient. Some of the themes that I pulled out that I heard Rep. Deal talk about, I was really, really struck by one of the early points he made. And it resonated for me in a couple different ways. One, he said, we need an effective and accessible healthcare system. Everyone needs access to good healthcare. And I don't think anybody could disagree with that. How do we do that when I would argue we have so many healthcare delivery systems in our state? I would argue that we don't have a healthcare delivery system. We have a number of different systems all doing their own thing. And I think that's even true in Medicaid. We have a multitude of different payers that all have their own way of doing things that directly impacts the provider and patient's ability to access healthcare. And I think that problem gets to another point that the representative called out: administrative burden. He said that's one of the most common issues he hears as vice chair of the healthcare committee. Lawmakers oftentimes, in trying to think about how do we collect more data to solve this problem, add some administrative burden. And so it's a system-wide problem that many, many parts of it are complicit in creating.
I think to Marty's point, the way that he framed the issues in healthcare as really systems level and his appreciation for the governor's advisory table to come and start looking at the Medicaid system as a whole. I think systems level work is really challenging, especially when it's bogged down by bureaucracy. It takes a long time to change things, and it takes an even longer time to change an entire system. When you're changing single issue by single issue, it can have unintended consequences in different aspects of the healthcare delivery system that maybe you didn't notice when you were addressing that single issue in the state legislature. And then a different advocacy group comes back and goes, that wasn't quite right. Or even maybe sometimes the same advocacy group comes back and say, hey, actually in practice, this didn't work so great because we're just one part of a whole overall healthcare delivery system.
I have to say that I really appreciated his focus on primary care and the need for adequate funding. No one would argue that we adequately fund primary care in this state or this country. There's an old adage, you have to spend money to make money. That comes to mind. In the case of primary care, I think we have to spend money to save money. In a recent US Senate committee hearing, we heard that every dollar invested in primary care returns $13 downstream. Dani, I can tell you, if I could get that kind of return on my money at that rate, I would pour every spare dollar I have and then some into whatever that investment was. And Rep. Deal is spot on as it relates to robust funding for primary care. And again, I'm thinking about community health centers and as a network, 33 across the state, they're all rowing in the same direction as a system of primary care responsible for 1 in 4 Medicaid lives. But that means 3/4 of the Medicaid population are in another system of healthcare. And that creates a number of administrative burdens and so many other complexities that lead to a very disconnected and uncoordinated system of care. I also think Rep. Deal's right. We should take a hard look at the whole Medicaid landscape and determine how to make the best use of those dollars. He said we expect primary care providers to be, again, this is air quotes here, everything to everybody. When I heard that, I thought, wait, there's already a model where the provider organization is everything to everybody, and that's community health centers. The integrated model of care that is community health centers means that patients have access to their primary care provider, and just down the hallway in the same building is the behavioral health provider. And the dentist and the pharmacy are co-located too. It's an efficient and an effective model that saves money, improves efficiency, and improves outcomes.
I also appreciate how he was looking at it from a systems point of view, Medicaid in particular. He really emphasized how this is not casting blame on any individual, group, or entity. This is looking at the system itself and really making sure that it is not only serving the intended purpose of the program, but then also making sure that it's effective and does allow folks to have that care that they most definitely deserve.
The representative, I think he called it right. We have a system that we can't afford. And I don't think that's necessarily the fault of the state. I think that in our state have been operating a Medicaid program that is extremely robust and generous, and people have access to the healthcare services that they need to be healthy, that they need to live their lives, that they need to care for their families. That's not a bad thing. Because of pressures and decisions made outside of our state, we find ourselves in a position that's really difficult. And it is forcing folks to take a really hard look at what do we offer in the Medicaid program? And I'd go back to what I said earlier. Lawmakers, in my view, are going to be budgeting from a point of scarcity in 2027. So, how do we think about where to target those scarce dollars, target those investments? And, I said earlier, I think that as the state is considering where to invest scarce resources, primary care, and specifically the community health center program, I think just has to be a place where we take a really hard look. It's efficient, it's effective, and it creates really good outcomes, particularly for those in our communities who we have disinvested in for decades, and in part because it's systematic. And so let's focus our investment in those places and focus our investment in the places that are serving those populations and the broader community. There's no special insurance needed to get care at a community health center. You just get to go because it's in your community and it's there. And the quality of care is incredible.
I do want to hear both of your thoughts on the comments Representative Cyrus Javadi shared during that interview, especially since he has such a unique relationship with his local fairly qualified health center, Tillamook County Community Health Centers. What were your thoughts about that conversation?
There's a function in every health center that is appealing to someone. Representative Jowdy found that in the dental space. And I heard him say that the traditional dental office is built around patient choice, whereas in his view, the FQHC is built around access, specifically for people who otherwise would fall through the cracks. Rep. Javadi used a figure that he attributed to HRSA, Health Resources and Services Administration, that over 90% of FQHC patients nationally are below the federal poverty. When we're talking about patient choice versus access, that means the FQHC patient, the bulk of them, they are choosing between healthcare, food, and or housing. They're not making a choice about having that filling repaired. They're saying that's not even an option for me unless it's covered by Medicaid. And I found it just fascinating to listen to him talk about, well, if you're missing 5 teeth, that's not covered. But if you're missing that sixth tooth, then we can fix it. And I'm thinking to myself, if it's not covered, folks aren't actively making a decision not to have the work done. It's not even an option to make that decision. And to hear him talk about his connection to the health center program and that it's really about filling in, pun intended, those gaps in the healthcare space, Representative Javadi pointed out the fragility of the system, particularly for FQHCs. And we're facing that head on right now. Maybe health centers are doing some implants for those 5 teeth. Even though it's not covered in Medicaid, they're doing some of those services that aren't paid for by Medicaid because they have a little bit of flexibility there because of federal grant, because of the way they bill Medicaid. When there aren't as many Medicaid lives to bill, when there aren't as many marketplace lives to bill, then all of a sudden the number of uninsured people grows and it becomes a decision point for the organization to say, maybe we can't keep doing these expanded services. Even a federally funded program like the health center program has a breaking point. I believe we are headed in a direction where if we don't adequately fund the safety net primary care program in the state, namely health centers, we're going to find ourselves in a place where there is less access to healthcare.
Going back to what you were mentioning about underserved communities and how community health centers are dedicated to serving members of our communities. One of the comments that Representative Cyrus Javadi mentioned when I posed the question of why is health advocacy important? I really appreciated his response of how advocacy means someone missing out on opportunity that could enhance their livelihood. And it takes someone to say, this isn't right and this must be addressed. So, why is it important for health centers and other providers as well in primary care settings to understand key areas important to state legislators?
I think the short answer is lawmakers are human and humans make decisions based on experiences. Simple example, I have a 4-year-old who wouldn't eat a cinnamon roll. No matter how much I told him it has sugar in it, you're going to like it, he wouldn't eat it. It looked foreign to him and he wasn't going to try it until he did. And now that experience told him I should eat more cinnamon rolls. I think it's the same thing with you or me or a lawmaker. They have a certain frame of reference. They have certain experiences. And so when we're asking ourselves, what do we need to understand about how folks make decisions? It's really understanding them as human. And by understanding a lawmaker's background, values, experiences, those are all keys to understanding how they make decisions as elected officials.
Yeah, that is exactly what advocacy is. Reshaping a process or system to better address your own needs. Oftentimes, that aligns with someone else's experience. And I have a personal connection to advocacy. My own personal journey to better health started at a very young age. I was in my teens. And as a woman of color navigating the healthcare system, it made me realize that I needed to both understand what the current structure is and other areas that need to be improved. That's why I really enjoy what I'm doing here at OPCA. Erin, what are your thoughts on advocacy and the importance of understanding key areas important to state legislators?
When you understand what appeals to lawmakers or the background that they're bringing into the work that they're doing, it's the path of least resistance. I think something important to understand about the legislative process is these lawmakers are being inundated with so many legislative concepts each session, particularly in long session. The docket for bills that just come through the Senate Healthcare Committee are so vast. And you have to think each representative or senator is sitting on multiple different committees. They have a lot of competing priorities competing for their attention. So when you take the time to figure out how to tailor your messaging to be impactful and substantive and relate to their experience, when you figure out how to get them to eat the cinnamon roll, it sticks with it, right? And what we're trying to do when we're trying to align our messaging with lawmakers' priorities and their passions is we're trying to remain relevant in their minds, at the forefront of what they're thinking about. And if you can strike that balance where you bring your passion for the health center movement and you align it with one of their passions, well, passion is one of the most powerful motivators. If you can get someone to really believe in your mission and your cause, you're going to be at the forefront of their minds when they're making decisions. And I think that that's really the goal of figuring out how to relate to legislators on a human level.
I first want to call out the fact that I am loving the cinnamon roll analogy that we're using. And I know that a lot of people will be judging us for saying, like, aren't you in primary care and shouldn't you be talking about vegetables? Let's all be very real for a second that we all love our sugary treats. And I want to acknowledge the fact that you mentioned passion and how that is a huge influencer because it's true. When you can tell that someone really cares about the issue that they are advocating for, you feel it, you hear it, and you see it. It makes you more inclined to pay attention to the message. And that was something that I really noticed in my conversation with Representative Javadi. The passion that he has for dentistry. And on top of that, the passion that he has for serving his community in Tillamook County. I know that Representative Javadi is very unique because of his ties to his local FQHC, Federally Qualified Health Center in Tillamook County, because he is the dental director of the health center. That makes me realize when you take the time to educate your lawmaker on understanding the model of how you deliver primary care in your community, it really helps them have so much better of an understanding of the value and impact that a health center has, that a provider has on the community with the constituents that that lawmaker is representing and truly working to improve their everyday life. Erin, in your opinion, why should a health center incorporate a culture of advocacy within their organization?
I want to start out answering this question with an acknowledgement that incorporating an advocacy culture at any organization is incredibly challenging. Most advocacy organizers, community organizers will tell you it's hard. And then you add in the additional layer that most of the time, those advocating at health centers have different full time day jobs. They're clinicians, they're front desk staff. Advocacy sits on top of the body of the work that they already do, and advocacy and healthcare itself both have high burnout. So, acknowledging that developing a culture of advocacy is hard work, I think it's the first step. And then trying to position yourself and your organization to do it in a really sustainable and thoughtful way. It's not a race. Developing advocacy cultures take years, and that can sometimes be discouraging because it's not, instant and the passion's there, right? We're so passionate about something. We want to see it come to fruition so quickly, and that's not always possible. But those sustained efforts over time really do have a benefit. And I think one of the biggest benefits of developing an advocacy culture at your organizations is recognizing that advocacy work really is sustained effort over time. The systems that we exist in are resistant to change at some points. And even if they're not resistant to change, it just takes a long time to have your idea come to fruition. You need sustainability, you need that foundation. And I really think developing that culture, taking that time to be intentional about developing that culture, is allowing you to have this home base to return to. So year over year, you can keep pushing towards your advocacy goals as an organization. And hey, it wasn't successful this time, but that's okay. We're resilient. We have that advocacy culture here at our organization to sustain this effort over the years to come. And one other really important aspect of developing that culture within your organization is it makes it a collective, right? You're having your staff bought in. You're having community that they can lean on. Advocacy work, trying to do it in a silo, trying to do it alone can cause massive amounts of burnout. But feeling supported by your community of coworkers, by the organization that you work for, feeding off of each other's passion for the work, that's beautiful. And it builds momentum and it builds strength. I mean, there's strength in numbers and there's strength in community. And I really think that even though it's hard work, and I don't want to take away from that, it's hard. It's hard. Really honing in on how to make it sustainable and supportive can make the difference in what you're able to accomplish.
I think the point Erin made was so important that advocacy and building that culture is really hard. And it's not just hard because it's added on top of someone's day job. We're asking you to lend your voice to have those conversations with elected officials. One of the things that makes advocacy hard is that the loudest and most frequent oftentimes is the most successful. And that is an immediate barrier to so many people who are working full time and who may not have the resources to drive from Portland to Salem or from Springfield to Salem or from Wheeler, Oregon to Salem.
From Oregon to DC.
Totally. If we aren't talking to lawmakers, someone else is. And if we want to be successful as health centers and the health center movement, I think making incremental movement towards what we want as the end goal, that's how we're successful. And I think that's how we win.
To that point, especially when you say leaning into the collective power of advocacy in order to prevent individual burnout is valid, especially when I think back to my own personal experience before being in this position within OPCA. I worked very closely with advocates, hearing directly from them the experience they had between, going to school, having a job, engaging with loved ones, and on top of that, also being a leader within their community. It was tiresome. They said so, but they felt that they had to step up because if not then who? And that is very much what I see when I speak to folks, hearing their experience of how proud they are of the work they do, but also how the challenges that we're facing right now of that administrative burden added on to delivering care is really difficult to get past in order to be there for their patient. And this is why it's really important for community health centers to understand OPCA is here to support them and enhance their ability to not only deliver care, but be present in health policy to make sure that the voices of patients and their own staff at the health center are heard so that lawmakers are better informed on how to make these really important decisions. So, Erin, can you go into how OPCA supports health center advocacy?
Yeah, I would love to talk about that. Oregon Primary Care Association is really looking at this comprehensively. We're looking at how to build low barrier ways to engage. Maybe your organization doesn't have the capacity to take on this huge undertaking of really embedding an advocacy culture within your strategic plan, within your respective health centers' day to day actions, but you want to engage. And so, part of the way that I think OPCA is showing up and showing out is supplying health centers with those lower barrier ways to engage. Whatever way that you can show up, the most important thing is that you are showing up. The first level here is how do we, as the Primary Care Association, make that as accessible as possible? How do we create templates that you can use? How do we run advocacy campaigns that you can join? How do we have Day at the Capitals to make it easier for you to engage in these spaces? And then I think the second layer is how do we support health centers in developing that advocacy culture? Like we just got done saying, it's hard work. It's challenging. And one of the goals that I know that Dani and I had when we created this advocacy work group was to really figure out what tools and resources can we create at the Primary Care Association to make that process of developing an advocacy culture easier. Not that it'll ever be easy, but easier, in my opinion, is the role that the Primary Care Association is playing. And I'm excited to share with all of you some developments as we unravel them.
As both Erin and Marty said, developing a culture of advocacy takes time, and that's okay. The Oregon Primary Care Association is committed to making advocacy less overwhelming and more like a natural part of how you advance access to care within your communities. Erin and I convene an advocacy work group with representation from 12 health centers to identify relevant, practical, and responsive resources to enhance health centers' capacity to advocate on policy priorities. If you work at a federally qualified health center, you can access these resources today through the OPCA member portal. Perhaps you're a community health advocate interested in taking your advocacy efforts to the next level. Then please reach out to either myself, Dani Gehrke, or Erin Woods to learn more. We hope today's commentary gave you something to consider, whether that's a new perspective or simply a reminder of how the work you do impacts the health of Oregonians beyond the walls of your health center. If you don't want to miss the next episode, make sure to subscribe to this podcast to receive notifications of when new episodes are released. Today's conversation was produced and edited by Dani Gehrke and fact-checked by Priya Thorin, who also helped with research. I'm Dani Gehrke with the Oregon Primary Care Association, and thank you for listening.